And right now I want to bring in Dawn Coley, and she is the Tribal Healthcare Reform Outreach and Education Program Manager for the National Indian Health Board. And it doesn't say your tribal affiliation.
I'm Penobscot from the Penobscot Nation.
All right. See, we are covering lots of tribal ground.
That's right.
Here. So, Dawn, thank you for joining us.
We've
been having a time. You're so busy. but health is really, when we think about it, health is. You got to have your. Everybody says that you got to have your health. Lean on in here. There you go.
Lean on.
Lean in. But yeah. There you go. But I mean, everybody says, at least you got your health, because it's that. I mean, that's the most important thing when you really think about it. Because if you don't have your health, then it's a big struggle, and it's been a big problem in Indian country for years and years and years. But are we making any strides at all?
Well, the program that I work with provides outreach and education on the Affordable Care Act. And as you know, this is a triumph in Indian country because it helped reauthorize the Indian Healthcare Improvement Act.
Right.
So it strengthens our Indian health services, and we know that we don't always have enough funding to provide anything but maybe a priority one service. So it gives options to American Indian Alaska Natives to look at health insurance in the marketplace and to find maybe an affordable plan. And we've seen some great success with that. And our trainings, we're very engaged. And the National Indian Health Board has been working on this program now for about 4 years.
Now, a lot of controversy over the Affordable Care Act. The GOP, Congress, they have the majority in Congress, and they've been trying to pass bills to repeal it. And are you?
I'm not affiliated with that.
No. I was going to say, do you think that there's a chance that it could be repealed? And if so, how would that affect the Indian reauthorization healthcare?
Well,
Improvement Act. Is that what it's the Indian Healthcare Improvement Act? But
it's been reauthorized.
So separate
from
Affordable Care Act.
Right.
Oh, okay. Because I thought if it came attached to that. But no, I guess what I'm asking is I guess it's still in the every couple of years it has to be reauthorized. Permanent reauthorization.
It's permanent.
It's permanent?
Permanent. Yes.
Oh.
Yes.
Well then, thank
That's
you.
it.
Thank you for the answer. No, I'm just kidding. But tell me a little bit more about the NIHB, because a lot of people don't realize that. And you guys are based in D.C.?
D.C.
Right,
Yes.
Washington, D.C. And I guess a lot of people might. How are you affiliated with the Indian Health Service, if at all? And you guys are separate. You're not government, right?
No, we're a nonprofit organization.
Right.
Yes, and but our funding streams, like the program that I work under, is funded through the Indian Health Service, and it's part of a National Indian Health Outreach and Education Program. So we work with the National Congress of American Indians, the National Council of Urban Indian Health, and the 11 regional health boards. And we all work together to kind of synthesize on training, education on the Affordable Care Act for American Indians and Alaska Natives.
Okay, so you contract with IHS.
Yes.
Okay, because they have enough on their hands serving the patients and caring for the people out in Indian country. So they get you guys to do the outreach.
That's right.
See, I learned something.
Yes.
I learn something every day. I learn something every day. But now, when we talk about health, though, for years and years and years, Native Americans had the shortest lifespan. And now, have we seen that remain? Have we seen it decline, or are we inching up at all?
I think we're inching up. I do, because every year, we're promoting that preventative component of preventative care. So that's very important. And again, for us to be able to have options, it's a triumph for us now.
And
Because a lot of us never had health insurance,
Exactly.
so I think that's really a big triumph, and it's really going to help in a lot of ways.
Now I know,
Positive.
yes, and I know a lot of people that work at IHS, and they're always saying, a big boost to our funding would be if we could, get people to apply for Medicaid. That was because IHS gets reimbursed.
Right.
And
Just
that
third-party billing.
Third party. Okay, so
Right.
if it's Medicaid or whatever, third party billing. What do you, as far as the outreach and trying to influence people to sign up for whatever third party, if it's insurance, if it's Medicaid, if it's something else?
It does bring more revenue back into the clinic
Yeah.
to help provide more services. So it's an advantage again, to help individuals or provide those resources for them to sign up for Medicaid or private insurance, only because they can third-party bill and bring that billing back into the clinic to help provide some more services.
Yeah, I mean it could be millions of dollars, hundreds of millions of dollars could be saved that way, and I think it's really important that people
It's very important.
get that message. And and so when you say outreach, what is that? PSAs? Are we talking
Public service announcements,
brochures that you put up in the clinic?
Yes. And here at NCAI we have a booth.
Right.
So booth number 34, and we are
Yeah.
providing on-site what you call presumptive eligibility for enrollment in the marketplace. So I
What
can
is that?
screen, I can. What we do is you create an account for an individual so they can go on the marketplace and look for their options for health insurance.
Right at the booth?
Right at the booth, and then also we're helping them to file what's called an exemption waiver application for
Right,
American and
because,
Alaska Natives.
Tell
That's
our
correct.
viewers about that, because I don't
Well-
think everyone knows.
Well, it's important that by the end of 2014, every American needs to have essential health coverage, or minimum essential health coverage. And we have a lot of American Indians and Alaska Natives that use the Indian Health Service for their primary care provider. And the Indian Health Service is not deemed as minimum essential coverage. So you can still use Indian Health Services, but be sure to file that exemption
You've
waiver.
got
so
to
you-
file
you've
that.
got to
Okay,
file
see,
it.
I didn't know that.
Yes, you've got to file it. Yes, or you can
I'm-
file it by paper, and you can take the application off the marketplace, or you could also file it at tax time. On September 18th, Secretary Burrow announced that we can now file the exemptions through the tax filing process. So
Oh, wow.
it's a lot easier.
But do you have forms?
I do. I have the forms at my booth.
I'm
yeah.
gonna come get one.
It's important. I know. I know.
Just
so
in
we do
case,
a lot.
it's
Yeah,
like-
we do a lot of training, and I mean it's our form. So we encourage individuals to file that form.
Okay.
It's not mandatory, but
I
we
didn't-
encourage that.
I didn't
Yes.
know. I need to do that. Okay.
Yes.
All right, Don.
Thank you very
See,
much.
I told you it was
Okay.
going to be easy.
Yeah.
Okay. All right. Thank you very
I
much.
keep
we
looking
appreciate
at
you.
myself.
Oh, you did
See my
fine.
read.
You did fine.
Thanks.
All right. Thank you, Don.
You're welcome.
From the Penobscot Nation, the
That's
great
right.
Penobscot
That's
Nation,
right.
and that's right.